In this video, I'm going to show you the best sciatica exercises for quick sciatica pain relief. Keep watching. Not only am I going to demonstrate these sciatica relief exercises and stretches, but I will also customize them for your specific pain needs. What this means is some of you may have mild sciatica pain and you'll be able to do more advanced stretches and exercises. If you're in this group, I will show you 2 advanced sciatica relief exercises to help relieve sciatica nerve pain and also help stabilize the lower back region. The goal is stabilization and prevention of sciatica leg pain recurrence. Some of you may have moderate sciatica leg pain and will tolerate somewhat advanced sciatica stretches and exercises. If you're in this group, I'll show you 2 mid-level intensity sciatica relief exercises. The goal here is to remove pressure and irritation of the sciatic nerve for leg pain relief. And some of you may have severe, debilitating sciatica leg pain and will tolerate only light lower back and pelvis mobility exercises. The goal is to carefully alleviate the inflammation on the nerves of the lower back that cause sciatica leg pain with light mobility exercises. And be sure you watch the entire video because I will also show you how to progress through each level of exercises. Plus, I'll give you all the repetitions, sets, and frequency recommendations for each exercise. Now, regardless of the level of sciatica pain intensity you're experiencing, the goals of these exercises are to reduce the sciatica leg pain quickly, to help you sit and walk better without leg pain, and to get back to living your normal life again. Hi, I'm Dr. Joshua Gelber. I'm a chiropractor in the Annex area of Toronto, Ontario, Canada. We focus on helping people overcome headaches, dizziness, vertigo, neck, shoulder, and back issues through specific chiropractic spinal correction techniques. Before I dive in, smash that subscribe button if you want to enjoy a more comfortable and active life with better posture, increased mobility, and free of chronic pain. Now, before I demonstrate these sciatica relief exercises customized for each pain level, I want to first explain the concept of peripheralization and centralization. The goal of the exercises is to reduce the sciatica leg pain. And when pain is traveling from the source of the problem, the lower back and buttock region, into the leg and foot, this is called peripheralization, meaning the pain is moving distally or away from the source. Peripheralization is a sign of a lower back or sciatica nerve problem getting worse. Whereas the goal of these sciatica relief exercises is centralization. Centralization means the pain from the foot and leg is now moving proximally or toward the body and localizing in the buttock and lower back region, the place of origin of your sciatica leg pain. During centralization, the buttock pain and lower back pain, it may seem like it's getting worse or even increasing moderately. While it may not be comfortable, it's actually a sign of the sciatica leg pain improving. You can centralize pain, and we see this commonly with patients. Now let's dive into these sciatica relief stretches and exercises that are customized for each level of pain intensity. Now, while these exercises are safe to perform at home, you must always be mindful. Don't continue or do any exercise if it causes more pain. And it's always good to check with your doctor or therapist before starting any exercise. Let's start with level 1. The most severe sciatica leg pain group. But let's define most severe. This is the person whose leg pain is so severe that they have trouble getting out of bed. They have difficulty sleeping, standing, sitting because of the leg pain. And they may even have trouble walking. They usually rate their pain as a 7, 8, 9, or 10 on a scale of 1 to 10, 10 being the worst pain. Here are the 2 exercises that I recommend to my patients with severe sciatica leg pain. Number 1 is a seated pelvic tilt. The goal for the seated pelvic tilt is to relax the musculature around the sciatic nerve roots in that lower back buttock region. And the goal is to actually engage the abdominal muscles. This can be done on your most comfortable but firmer chair. You don't want to be in a softer lounge chair, but you likely aren't able to get into one comfortably at this point. So feet can be on the ground. Sitting as upright as you can tolerate, and you're letting your hips tilt forward and then contract back. So this means engaging the abdominal muscle. No matter what your body type or body shape is, You're just trying to bring your ribs to your hips. I'll show you that from the side. Don't straddle a chair, so from being forward, stomach more relaxed, to engaged. This is just tipping and tilting the pelvis from a seated position. Try this 10 times. And because of this most severe level of things, you can go 2 or 3 times, even 4 times a day to your comfort. I'd say expect mild relief, possibly some muscle strain, some muscle activity. The muscles protecting your lower back haven't been working for a while. They haven't been engaging normally. So some discomfort is natural and normal. Let's go through 5 more. Always important to breathe as you go through any exercise. It's when we don't breathe that things can have more strain. And 1 more. There you have the seated pelvic tilt. Number 2 is the cat camel. Known by a few different names, this exercise requires you to be on all fours. The floor, the couch, find somewhere supportive, even the bed, somewhere supportive that you know you'll get back off the ground or down from. Okay? So, arms straight down from your shoulders, knees straight down from your hips. And like the previous exercise, the goal is to mobilize and activate the lower back gently and comfortably. First, just requires a relaxing or dropping of the abdomen, of the stomach. This is where you can breathe in and slowly a breath out, drawing the stomach in, pushing the back up as if you were a camel with a hump, and then going back to the cat, arching their back, doing a morning stretch. Really focusing on drawing through with your abdomen and nothing else. Your hands and knees support and stabilize you. Now as you do this, you can hold for 2 seconds and back through. I'll do 5 more. One more. Like the first pelvic tilt exercise, it's natural and common to feel weird sensations in the back muscles that haven't been used. Some discomfort in the abdomen that you may not have been contracting enough. Making sure again to breathe. Breathing in the cat position, and breathing out in the camel position. It's a natural flow of the body when you do that. 10 in a row, and I would consider 2 times a day. Make sure again to find somewhere you can move to and from. If it's on the floor and you just need a break on the floor after, no problem. If the bed's firm enough and cushioning enough for you, great. Again, a soft couch, not as ideal. Let's move on to level 2, the moderate sciatica leg pain group. This is mid-level, from mild to severe. These people rate their pain at a 4, 5, or 6 out of 10. They may find sitting, standing, and walking uncomfortable, but are still able to do much of these activities without excess limitation. The 2 exercises I recommend to my patients with moderate sciatica leg pain are, number 1, supine piriformis stretch. You may have come across the piriformis name in some research. It's the only muscle out of the whole gluteal buttock region that actually sits over top of the sciatic nerve. It's unique in that sense that if there's tension, tightness, or strain here, it can actually aggravate the sciatic nerve away from its origin, but in its path down the leg. Find a flat surface. This is best performed on the floor or a firm bed as backup. I'm going to start on your back, both knees bent, and let's say the side affected is my right leg. I'm going to cross the ankle over, and this is where you're just going to start to reach and pull just below your knee. So you can wrap and interlace your fingers through, and you're pulling this knee to the opposing hip or shoulder, pulling it towards the left side. If the sciatic nerve is tense under the piriformis muscle, you will feel some pull and even some possible electricity when you do this. Again, pulling straight down, not as effective as over. And I'm just letting go for demonstration visuals. This is a stretch you can repeat 3 times, holding for up to 30 seconds. Nice, slow holding. Given that time, you want to let the muscle relax and reduce aggravation on the nerve. My internal count give out. So from that stretch, come back and let it relax here. You can go all the way back to neutral before you repeat. The piriformis muscle can be tight regardless. You may find yourself inclined to stretch the other side just to release any compensation occurring in the buttock region. Again, pulling across to the opposite side. Go back to this side one more time. If you find yourself with any pinching in the front, that could be the hip flexor muscle showing some tension, something that can be checked with a chiropractor, therapist, and you can sometimes moderate your position, bring things over further to reduce that pinching pressure feeling in the front, as this really again is focused on stretching through here. This can be repeated daily, a set of 3, not first thing in the morning. You want to avoid activity or a stretch like this right after a rest. You want to engage and mobilize first before doing this. So after a work day, after a walk, is a great time to get a deeper, more effective stretch here. And that's the supine piriformis stretch. Number 2 in this moderate group are low back, knee to chest stretches. And while this targets the glute and buttock region, it will also start to relax the adductor muscles. They sit right in here. They tense up and get tight from lots of sitting, from leg crossing, from all movements like this, or not enough strength on the lateral outside of the leg. Relaxing here works its way through the pelvis to relax those same muscles around the origin of the sciatic nerve. In this situation, again, now I'm going to switch to the left leg being the affected side, but ultimately you'll do both sides with this stretch, not just the symptomatic side. So the leg can be straight out. It can also be dropped over a chair or a bench. And very gently with your knee bent, this is a straight on stretch, straight up the body, fingers interlaced. Gradually and slowly bringing that knee towards the chest. Again, possible that you'll feel some pinching in that hip flexor muscle like the other one, but you should feel a gentle and steady stretch on the inside of the thigh. You can start to bring this stretch out to the side, again, depending on body type, comfort, and ability. If your leg is flat, you'll want to bring it further. If your leg is dropped to the side, that already increases the point of tension in a positive way. Be mindful of your comfort threshold. And then you're bringing the stretch up, holding for up to 30 seconds, repeating 3 times. You can take a break simply in this position. You can do alternating from right to left and back. Be sure you're wearing comfortable clothing with a low interest in tearing your pants in the crotch region. It's always got to be a smiling moment no matter what information is gleaned from the video. And be sure that your alternate leg is really relaxed as you pull up for the most effective stretch. Three times, 30 seconds, daily, after activity, not after dormancy. And now level 3, the mild sciatica leg pain group. Now for those with mild sciatica leg pain, you can start getting into some more advanced exercises. These people rate their pain usually a 1, 2, or 3 out of 10. They're able to function relatively unhindered in their day-to-day life, but they still are likely to have that nagging, uncomfortable leg pain. It's present, it's irritating, it's there. The first exercise is designed to relieve stubborn sciatic leg pain, and the second exercise is designed to stabilize the lower back and pelvic region to prevent recurring sciatica leg pain. Number 1 is the seated sciatica nerve floss or the nerve glide. You want your feet clear of the ground if possible, add a cushion to your seat, but it's not critical. Like any nerve floss or glide, whether you've done them before or not, you're going to be trying to stretch and pull and release a nerve that's entrapped in certain places. This tends to lead to some awkward feeling, almost like flossing the teeth and feeling that awkward sensation near the gums, if that has a familiarity to it. With this, you want to work on the affected side. If your sciatica seems central, do both. If it has history or sensation more towards one side, one leg, one hip, focus on that side. You're more than welcome to do both. We're going to focus on the left. You're going to be sitting upright, bringing your knee into extension, toes back, head up, and together you will follow this motion of toe forward, head down, leg down. It's more than likely that coordinating this motion will feel hard and awkward at first. You'll find your rhythm, and you should find that some of the sensation comes under the thigh, the upper leg. We want to go 10, perhaps even 15 times. This can be repeated 2 times. This is an exercise that can be done first thing in the morning, midday, nighttime, because it's activating things and it's an active movement. It doesn't have to wait until after you've moved. Whereas stretches aren't always as effective before movement or activity. Do 3 more. It's always key to go slow and steady with any of these to get the right effective movement and result from it. Number 2, the bird dog exercise. I'm not going to lie, this is one of my favorite core exercises, even if you don't have any sciatica symptoms. It's something you can utilize ongoing. Specifically for sciatica, this is engaging the core and lower back and stabilizer muscles, again, mobilizing for support and engagement and relaxing while strengthening this musculature. On all fours, fingers facing forwards, knees right under hips. Take some coordination as well. The goal for this exercise is a forward arm paired with an opposite leg extension. Very important key for this exercise, don't lift the hip. It's easy to engage way too much of the body in this movement. So arm goes out, leg goes out, keeping that hip level. If you need someone to supervise and show you where to keep that hip level at, absolutely relevant. And you're going to alternate sides. Wait till one side is down and planted before getting the other side up in the air. Breathe in when you come into all fours. Breathe out while you engage. Repeat 20 times total, 10 per side. This is something you can do once or twice a day. It's a great morning wake up or before bed engager. But I would vote for before and after the work day or school day. If you find yourself more comfortable doing this, pick up the pace only slightly and making sure that you go all the way through the full movement as you do so. Now you have 3 sets of sciatica relief exercises that are customized for different pain levels. Here's the big advantage for organizing these exercises according to each pain level. You can use it as a full routine to progress to the next level when you're ready. For example, for those in the severe level of pain, you can start with level 1 exercise and then progress to level 2 and level 3 as your pain begins to improve. For those in the moderate level of pain, you can start level 2 exercises and then progress to the advanced level 3 exercise. And for those with already a mild level of pain, you're already at the advanced level, level 3. Stay subscribed to my channel because I'll be adding more advanced lower back strengthening exercise videos. Now I want to hear from you. What level of sciatica leg pain are you in? Mild? Moderate? Severe? Which exercise do you find most relieving? Was it the seated pelvic tilt or the supine piriformis stretch? The sciatic nerve floss? Let me know by leaving a comment. And be sure to like and share the video. It helps the YouTube algorithm find more people who can benefit from these exercises. It's as simple as that. Remember to subscribe if you want to enjoy a more comfortable and active life with better posture, increased mobility, and free of chronic pain. And if you want to get tips on how to manage sciatica leg pain while driving and traveling, watch this video next. You'll learn easy hacks and tips on how to make driving with sciatica leg pain more comfortable and tolerable.